So I want to begin today's session. We have what I think is an outstanding example of SPR's international work and international focus. I'll let each of the presenters introduce themselves, but we have the current chair of the International Committee, John Toombaru, Marina Epstein from the Social Development Research Group, and Sabrina Osterly, also from the Social Development Research Group, and a native German-born person as well. So we have good representation. I'm Rico Catalano. I'm the co-founder of the Social Development Research Group at the University of Washington. And still, even though I'm not officially the past president, no one else has that title right this year. So I'm still kind of the past president of SPR, maybe the has-been president. This is an international work that we've been doing for multiple years. There are many folks on the project. We have been funded by NIAAA and the Australian National Health and Medical Research Council. And our original first 3 years of data collection was funded by the National Institute on Drug Abuse. Just to give you a little picture, we know for those of you who have the little block pictures of the world and the sizes of continents and things, you know that Australia and the United States are about the same size, at least geographically speaking, the same size, but population-wise, there's large differences between the two countries. And there's other big differences between the two countries with a lot of seeming similarities. We both speak the English language, both have adopted it from the mother country of England, I suppose. But there's also some really critical differences as to why we chose these two countries and two states within those two countries to study. The national policy scene is quite different between U.S. and Australia. In Washington state and in the U.S. generally, the legal drinking age is 21. The government promotes no tolerance policies, just say no. We have medical marijuana from the study inception in Washington state and legal marijuana in Washington state after the age 25 data collection. And I'll describe the sample in a second. And there, in Victoria, the state of Victoria in Australia, they have a different set of state policies. Legal drinking age is 18. Government promotes, again, federal government promotes as well as state, a harm minimization policy in alcohol guidelines. When participants are adolescents, for instance, the policy suggests that there should be gradual introduction of children to alcohol use, and that parents should supervise their drinking and teach children responsible drinking. Medical marijuana has just gotten in right after our age 25 data collection. So it's just beginning in that state where it's been that way since our study inception. When did that study begin? This was a study sample of 7th grade students in public and private schools in Washington and Victoria. It was a 2-stage cluster sample, randomly selecting schools and then randomly selecting a class within each school. We had about 1,000 kids in each state. We used a modified version of the Communities That Care survey, which assesses a number of risk and protective factors for substance use and other behavioral health problems, as well as alcohol, violence, depression and anxiety, and other behavioral health issues. We did, when you do comparisons or international studies, it's very critical that you have the same methodology employed in both countries, because you're really trying to say, are the differences due to the state policy differences, and you want to establish that that might be a very probable cause, rather than differences in questionnaires, differences in sampling, differences in data collection procedures and coding, et cetera. So we did a fairly extensive cognitive pretest and pilot in 2001 with the modified questionnaire, changing some things that didn't make sense in each country, so changing what are your grades like in the US to what are your marks like in Australia, you know, simple cosmetic differences between language, but also then really trying to query kids in each country. What does that mean to you? Say back what you think that question said, and when a number of children couldn't understand what the question was about, we modified it to make more sense for the kids. So we had a longitudinal panel. The first wave was in 2002. We resurveyed at age 14, 15, so the 1 year and 2 year follow-up, also 10-year follow-up at age 25. We've just collected data at age 29 in the US and Australia's finished collection at this point. A little bit more to go. Okay, so we're almost done with our age 29 data collection. We'll probably talk to you then today about age 25. I think we can assume that. So our initial participation rates were 73 to 75% in each country, and then we have enjoyed a high follow-up rate since then, 87 to 99%. The sample size is about 1,000 in each country. The mean age is a little different between countries, a little younger in Victoria. They got a little head start. They started, I think, 2 months, on average, 2 months earlier. It was seasonally adjusted because the southern and northern hemisphere, so we wanted it to be in the winter in both countries. See about equally male and female. Ethnic differences, race and ethnicity in the United States. I think many of you are familiar with the language and around that we use in the United States. In Australia, they have different conceptions of race and ethnicity. And people, I would say, that aren't foreign-born or aren't Aboriginal folks consider themselves Australian regardless of their ethnic differences. So you can see we both have an Asian Pacific Islander population that's about 6% in each, as well as a large proportion of whites in Washington State, about 65%, but again, a healthy number of folks from other ethnic groups as well. The aims of IYDS in this current grant period are to really look at similarities and differences in persistence and desistance in alcohol use and related harms from age 25 through 31 in the 2 states, and really trying to understand adult environmental, individual, situational, and context-specific influences that may be producing these differences in rates, and I'll show you a little data from both countries, from the earlier data as well as the age 25 data, to show what the similarities and differences are, and really wanted to understand something about the timing of the transition to adult roles, if that influenced, if those were different in the 2 countries, and if that influenced persistence and desistance, because we know those transitions are really important in reducing levels of alcohol and other drug use. And finally, do environmental changes associated with marijuana legalization predict alcohol persistence and desistance? So primarily looking at the changes in legalization in Washington State, and to some extent have the ability to look at some of the medical marijuana changes in Australia. And we haven't seen the end of it yet because we have another data collection in 2 years to see maybe they'll have progressed to a different place. Did I have another point? Predictors, okay. It's more complex. So description of the samples at age 13, consistent with the harm minimization approach, Australians expected children to drink more, to have higher rates of initiation. Parents are supposed to teach their kids to drink, introduce it gradually, and teach them how to drink responsibly. No one was worried about the past year drinking differences between Australia and the United States, 22 to 45%. But they were worried more about the difference in binge drinking between the two states, because binge drinking is harmful drinking, and here it is 2.5 times higher than it was in Washington State at grade 7, 10% versus 4. There was little difference at age 13 in marijuana use or recent cigarette use. Now moving to age 25, so I just wanted to let you know a little bit. It really seemed like it was alcohol that was driving our differences in that policy around alcohol, perhaps some of the motivation for that. But by the time they get to be age 25, they're similarly employed, 81 to 85%. However, we have higher rates of high school graduation in Washington State, but also reports of more homelessness in Washington State. These are the significant differences, and more financial difficulty reported in Washington State among kids who are age 25. What was going on in the family at the time? About 20 higher rates of marriage in Washington State, 22, almost 3 times the rate of marriage in Australia, 7 versus 22, a little over 3 times the rate. More likely to have children, almost twice as likely, and on the other hand, more Australian youth were living with their family of origin than U.S. or Washington State folks. Physical health, about the same reported poor physical health or missing work in the last month. Mental health, again, fairly the same between the two countries. Thinking about suicide at the same rate as depression and anxiety in both states. Violence exposure and any criminal behavior, again, no differences. So we're looking at something trying to come into something maybe related to alcohol use, alcohol policy. Daily smoking wasn't different now, nor was it different at age 13. Marijuana use under a legal environment now, these kids, this is just before legalization, right? So it was just before, but they had full legalization, but they had medical marijuana, slightly higher marijuana rates, and less illicit or prescription drug use, despite all of the issues in the United States about those things. Today, now, we're going to be hearing 3 presentations. I gave you the context. We're going to be looking, Marina's up first, looking at explaining continuity and discontinuity in alcohol misuse from mid-adolescence to age 25. Then Sabrina's going to regale us with comparing alcohol availability at work and workplace drinking norms. We spent a lot of time on school-based policies and policy differences and how those led to higher or lower rates. But now we're looking at the young adult time frame and thinking about workplace and how workplace policies may influence drinking. And then John's going to talk about using cross-national data to advocate for youth policy changes.